Hello, my name is Diana. I do not have a model for today to show you my assessment, but I will still be showing you the process of doing an abdominal and thoracic lung assessment. Starting with the lung assessment, I could start with just like we do on every system. We start with inspection, palpation, percussion, and auscultation. First, we go ahead and inspect the chest for any discomfort, the rate of breathing on the patient. Then we go ahead and palpate any tenderness, anything that might bother in the patient, we can detect on palpation. Then we can percuss and check on the tactile parameters. Then we go ahead and we auscultate. We always use the diaphragm and we use it in a lateral position. Um, I can show you here in my assessment book that we go in a lateral position from side to side, down and side to side. We do this either because this is a picture of the back, but we do the same on the front and in the back. In the front, I always like to start on upper clavicle. We could start on one side. The reason why we're doing lateral from side to side is because we want to check that each side is equal to the next. So we start on top of the clavicle, then we go ahead to the other side. Then we come down and listen to the other side. We bring it down and bring it to the other side. In the case of women and also in men that have large breast tissue, we would just ask them to just move them over so that we can perform our assessment. So when we go and then we can go ahead and look at the back of the patient and we're gonna look at that the chest is symmetrical, that there's no intercostal muscles in use. And then again, we're gonna be using the lateral side to side method of performing this assessment. It is important to recognize the normal breath sounds so that we can recognize the abnormal ones. For example, for the trachea and the larynx, we can hear high pitch, loud sounds, while over the major bronchi, we can hear moderate sounds, and over the periphery of the lungs, we can hear low and soft breath sounds. Any presence of adventitious sounds like wheezes and crackles are important to detect at the time when they are present, so we can let the physicians know and then that right diagnosis could be made. On the other hand, the abdomen assessment is totally different from any other assessment on the body. The normal inspection, of course, is inspection, palpation, percussion, and auscultation. In the case of the abdomen, we just start by inspection, auscultation, percussion, and lastly, palpation. The reason why we do this, regular assessment can increase the peristalsis, which would give a false bowel sound. And by acquiring a false bowel sound, we can definitely make wrong decision and the wrong diagnosis of the patients. Um, Going back to the lungs, I currently work in a long-term facilities, and we have, of course, older patients. In the older community, and I have noticed also that we have to keep in mind that the coastal ridges becomes calcified with aging and results in less thoracic movement. So we always need to take that into consideration when we're doing an assessment on older individuals in regards to a child or a normal adult. They get easily fatigued when they start to breathe in and out every time that you ask them to, so that we can get the right breath sounds. So sometimes rest is needed so that you can actually go ahead and finish your assessment. Okay, very good. Well, thank you